Should not be afraid. People should not be fearful. The hospitals that are actively functioning in the region are providing excellent care, and care is available.
After Glenwood Regional Medical Center has been under the microscope for the last year. Good evening to you. I'm Jennifer Andrews. Well, during an April 9th hearing before lawmakers, interim CEO Jonathan Turton admitted deaths have occurred at Glenwood due to the mismanagement of its parent company, Steward Healthcare. Well, amid the staffing and supply issues, other hospitals are caring for more people. St. Francis Medical Center in Monroe says it's seen a big increase.
We have seen a significant influx of patients through our emergency room. We've gone from averaging 130 patients a day to about 160 patients a day. When things are going through the community like COVID, the flu, we've seen significant surges, sometimes going over 220 patients in our ER in a day.
Well, due to the increase, Gillette says the State Health Department is evaluating some of their rooms to increase the amount of adult beds, especially for people who need cardiac monitoring. The hospital has 321 licensed beds compared to Glenwood's 91-bed capacity. Now, in a statement to KNOE, a Glenwood spokesperson said, "We never refuse patients that enter our emergency room, and we accept appropriate patient transfers from outlying hospitals." It also says all patient-facing services, like emergency services, are open and available to the community. For more on our investigation into Steward Healthcare's management of Glenwood, just visit KNOE.com and click 8 Investigates.